Hi, my name is Esther Malave and I'm a family physician. And I wanted to pop in here to talk to you about an experience that I had with my 17-year-old son yesterday in the emergency room. I was supposed to actually go do a talk at a church about mindset and positivity and changes in fitness and health. When my 17-year-old son that morning told me that he was seeing a black spot in his eye. Unbeknownst to me, he had had trauma the day before to his eye, and I assumed it was a um, floater. So I called around to see where I could get him in, and we ended up seeing a physician, an eye physician. And lo and behold, during the interview process, I found out that there was trauma the day before to his eye, which I wasn't aware of, and that we had to go to Will's eye because he possibly had a retina detachment or rupture. So needless to say, I had to cancel my talk and go into Philly with my son to Will's eye emergency room. When we got there, the receptionist was a little rude, and over time, we just basically smothered her with kindness, with being very respectful. And I don't know if it was because she had gotten a lot of rude people in the emergency room. I don't know what the deal was, but eventually she warmed up and greeted us back again with respect and kindness. And the woman who was the nurse that took Devin's vitals was wonderful. No issues there. But I decided to talk to you about the importance of, as a parent with a child, as a patient, as an advocate for a parent and patient, and also as an advocate from the other side, because I am a family physician and I do see patients every day at work, that if you're in customer service or if you are a healthcare provider, that you listen and listen to this video and watch it, hopefully till the end, because yesterday was an experience coming from the other side, coming from a patient's parent sitting there while my son was being attended to. So we went back into the waiting room and waited to then be proceeded to be attended to by a doctor. The first one was a female physician who I thought would show humility, compassion, and did not. And ironically, she says she's a doctor, but I know as a doctor who went through the system, she was a resident. So obviously you're going to introduce yourself as a doctor because you are. You graduate from medical school, you go into your residency program, so you are a doctor. However, bright lights in my son's eyes, which I get because you're ruling out a retinal detachment, totally get it. He's uncomfortable, but not once did she show empathy towards my son. Not once did she say, I'm sorry, or give him heads up, really bright light, or give him a break from the bright light. He apologized because there were times when he couldn't keep his eyes open or he looked the wrong direction, and he was apologetic, but not once did she show any empathy towards my son. So after that happened, and numerous times got drops, numbing medication, or you're going to get some more drops. Not really explaining what the drops are for. Okay, so she says, possible retinal tear, there's blood in the eye, and we need to go ahead and the retina specialist needs to see him. So we go back out into the waiting room, get called back in. Second doctor was another resident. Unbeknownst to me, he didn't say he wasn't the retina specialist. So really important for people who are laymen, ask questions, because I thought for sure that was the retina specialist. Comes in, does the exact same testing tortures my son again, says he's going to do the bright light, doesn't apologize, not empathetic, no breaks. I even asked him what the drops were for, numbing medication. At no point did they know that I was a physician. So I'm getting really upset at how there's no empathy, there's no compassion, there's no real explanation. Again, blood in the eye, possible retinal tear. He needs to see the retina specialist. So at that point, I was like, you're not the retina specialist? So yet another resident. So most likely the first one was an intern. This is a higher level resident. Now we have the retina specialist. Very aggravating, to say the least. And as a parent, I know the medical terminology. I know what they mean by blood in the eye. I get that they need to make sure that he doesn't have a tear or a detachment, because that could possibly mean laser or even surgery. So I can stay calm. Somebody else, no. They would be like having all these questions. They would be freaking out that their child, what do you mean blood in the eye? No explanations. Get back in the waiting room. Several hours that we've been there. Now we get the retina specialist, who ends up being a fellow, which I figured as much, because obviously the specialists are at home, and I have no problems with that. Like I said, I've been through it. I was a resident myself a long time ago, almost 20 years ago. The fellow, who I will say, his name is Dr. Ravi Pandit, and I hope I say it correctly, because kudos to him. He came in there and was compassionate, explained that the whole exam's going to have to take place again, very bright lights, apologetic to my son, to my 17-year-old son, took his time, explained everything to us, had to go and use a device to move the eye to be able to see a little bit better, to see the outskirts of the retina, make sure that there's no tear there. Explained everything and apologized to my son, because he knew that it was going to be uncomfortable for my son. And when my son was really squirming because it was uncomfortable, he took a break. Not a long break, but a break enough to get him, and complimented him on how brave he was and how he withstood the discomfort. Phenomenal bedside manner. Phenomenal. And at the end, I did tell them that I was a family physician. You know why? So that he knew when I told him, listen, I will be a family physician 20 years next year. Kudos to you for your bedside manner. Phenomenal. Keep it up, because you're doing a fantastic job. And explained everything to us. So listen, as a provider, I get it. We have to take on responsibility and be compassionate to our patients and explain things to our patients so that they're not scared shitless about what's going on, or to the parent who's sitting there watching their child undergo pain and feel helpless and hopeless. I didn't, because I have the medical knowledge. But yesterday was a valuable experience, not only for me as a provider, but hopefully people watching this ask questions. Like I said, I assumed that second doctor was the specialist, and it wasn't until the very end that I found out he wasn't. That was nerve-wracking and upsetting beyond belief. And I didn't make a scene for my son. But next time, you better believe I'm going to ask questions before they ever get examined again, or I ever get examined again, if I get into that situation. And God willing, that won't happen. But I decided to make this video for numerous reasons. One, because as a parent, ask questions. Ask what the medicines are that your child or yourself are getting. And if you don't agree, do not take it. You have a right to decline medications. Ask who the provider is. Is it a resident? Is it an attending? And in hospitals and emergency situations, it's usually a resident. And that's okay. But if you're going to be examined by multiple people, ask who they are and ask, because guess what? You can decline. Had I known that that second person was another resident and not the specialist, I would have declined. I would have said, no, we'll wait to see the specialist. We got her opinion that there was a something called a choroidal, actually, she didn't even say that. The specialist did. What am I saying? That there was blood in the eye, and that there was a possible tear. That's all I got from her. Well, I kind of got that from the doctor we'd seen in the morning. But anyway, but the other doctor did come in, and like I said, the retina specialist, who was a fellow, explained everything, and it was perfect. Possibly not a tear. There was a rupture of something else that's not as dangerous, and we have to go see the specialist on Monday. So we got a course of action. We got a plan. He answered all of our questions. Ask questions, which we did at the end when we got somebody who was compassionate and who was caring, unlike the other two. If you are the provider, keep in mind that these are human beings with emotions and feelings. And you have to take that into consideration when you're dealing with patients or with customers at a store selling a product. If you want more customers, you want more people to show up, you have to be sensitive and caring to their needs. And are people rude? Hell yeah. Do I have rude patients? Hell yeah. But it doesn't mean that then you counter with rudeness. Like that first woman who, when we first walked up, she was rude. She was absolutely rude. But my son and I, we don't play that game. We're respectful, and that's how I raised my son. So once she realized that we were respectful and kind, she reciprocated at the end and was kind and respectful back. It's a shame that she didn't do that from the very beginning. So again, lesson learned in multiple levels. So I really hope this video was useful. Take care.